Have you ever woken up in the middle of the night with your heart racing, feeling dizzy, and confused about what just happened? You might think it was just a bad dream or stress. Maybe, but sometimes, the real cause is something small you'd never expect. A handful of nuts before bed. Sounds ridiculous, right? After all, we've been told for years that nuts are great for heart health, cholesterol, and brain function. And that's absolutely true, but only when you eat them at the right time, in the right way. If you often snack on nuts before bedtime, especially if you're over 60, please take a few minutes to hear this. Because the truth is, some types of nuts, though seemingly harmless, can silently raise your blood pressure, disrupt your circulation, and even increase the risk of stroke during sleep when your body is at its most vulnerable. Do you keep a small bowl of nuts next to the couch every evening? Do you enjoy snacking on them while watching TV, relaxing after dinner? Do you think it's a healthy habit? I get it. I used to think the same. But as a neurologist with over 20 years of experience treating thousands of older adults, I can say clearly sometimes, even healthy habits become risky when done at the wrong time. So in this talk, I'll help you understand which nuts to avoid before sleep, why they affect your heart and brain negatively, and most importantly, how to make a small change in your routine that can protect your health after 60. Don't leave if you or someone you care about eats nuts every night. You don't have to give up your favorite snack. Just shift the timing and how you eat them, and you might see a big difference. Pecans tasty, rich, but can thicken your blood. Pecans are often seen as a premium snack. They're rich, buttery, and show up in many holiday desserts. Just one small serving, about 1 ounce, or 28 grams, can pack over 200 calories and nearly 20 grams of fat, most of which is saturated fat. The issue lies in the timing. During the day, when your body is active, those fats are digested and processed gradually. But at night, your metabolism slows down and blood circulation decreases. Fats that aren't processed properly can make your blood thicker, harder to move through your vessels. While you're sleeping peacefully, the silent risk of blood clots goes up. Pine nuts tiny, but harmful to blood vessels. Pine nuts are often sprinkled on salads or blended into pesto. They sound fancy and refined, and they are. But if eaten at the wrong time, pine nuts can throw off the balance in your vascular system. That's because of their high omega-6 content. Omega-6 fats are essential, but if you consume too much compared to omega-3s, which are heart-healthy fats, it can trigger low-grade inflammation in your blood vessels. Over time, chronic inflammation weakens vessel walls, making them prone to rupture or plaque buildup. This is especially dangerous for people over 60, whose blood vessels are already less flexible. Hazelnuts, the vasodilator you don't need while resting. Hazelnuts are rich in arginine, an amino acid that boosts nitric oxide production, which helps expand blood vessels and improve circulation. Sounds great, and it is if you're being active. But when resting, especially during sleep, too much vessel dilation can make blood pressure unstable. Even drop it suddenly, especially if you have a history of low blood pressure or weak circulation. This rapid shift can make you feel dizzy when turning in bed, and it may also lead to tiny blood vessels in the brain becoming damaged. Trail mix, the pretend healthy combo. Trail mix, a blend of nuts and dried fruits, seems like the perfect snack. But most store-bought mixes are loaded with salt, sugar, and preservatives. 1 ounce can contain up to 150 milligrams of sodium and 12 grams of sugar. But honestly, who eats just 1 ounce? When sugar and salt enter your bloodstream together, they trigger inflammation, cause water retention, and raise blood pressure, slowing down circulation and making your blood more sticky at night. The result? A nighttime traffic jam in your bloodstream, a sharp rise in blood clot risk. Salted almonds, making your heart work overtime. Salted roasted almonds are a crowd favorite, flavorful, crunchy, and easy to snack on. But salt is the problem here. Just 1 ounce contains 150 to 200 milligrams of sodium. Mindless snacking while watching TV can quickly push you past the recommended daily sodium limit. Salt causes water retention and raises blood volume, which means your heart has to pump harder when it should be resting. At night, instead of recovering, your heart is under pressure. Pistachios light to eat, heavy in effect. Pistachios are fun to crack, easy to eat, and often labeled as healthy. But they're also high in arginine and usually sold salted. That combo of vasodilation and sodium makes your blood pressure swing while you rest. This raises the risk of irregular heartbeat, poor sleep quality, and pressure inside your skull. Walnuts a golden food when timed right. Walnuts contain plant-based omega-3s, great for heart health and inflammation control. But if you eat them at night, when digestion slows, those fats stay in your bloodstream longer, raising nighttime triglycerides and reducing blood vessel flexibility. And high-fat content can also trigger acid reflux, leading to poor sleep, a racing heart, and increased cortisol, your stress hormone. When we think about exercise, we often picture the benefits: living longer, a stronger heart, a sharper mind. And that's all true. Movement is one of the best medicines for aging, but only when we understand the stage our body is in. Because once we're past 60, our cardiovascular system, blood pressure, and balance aren't what they used to be. Some movements, even simple ones, can trigger sudden drops in blood pressure, raise pressure inside the skull, or quietly increase the risk of stroke without us even realizing it. Here are 9 common types of exercises to be cautious with, not to avoid entirely, but to perform with the right form at the right time. Bending forward too quickly. Think tying your shoes or picking something up from the floor. It sounds harmless, but for older adults, blood can rush quickly to the head, causing a sudden drop in blood pressure, dizziness, or even a fall. Remember, the body needs a few seconds to adjust blood pressure during a position change. Twisting or rotating the neck too hard. Some people crack their necks to feel relief. But the neck contains 2 vertebral arteries that supply blood to the brain. Twisting too forcefully or too fast can compress or even injure these vessels. It may reduce blood flow to the brain, cause lightheadedness, and in more serious cases, trigger a minor stroke. Lifting heavy weights while holding your breath. It's common to hold your breath for extra strength during heavy lifting, but this can increase pressure inside the skull and cause a sudden spike in blood pressure. For younger people, that may not be an issue, but for those with high blood pressure, this is a dangerous moment that can lead to a stroke. Inverted yoga poses. Examples include headstands, shoulder stands, and handstands. Turning your body upside down causes blood to rush to the head. If your brain's blood vessels are weak or fragile, that pressure spike can lead to ruptures or microbleeds. Intense evening workouts. Doing cardio, HIIT, or fast-paced routines right before bed. It may sound healthy, but your body needs to wind down at night. Heavy evening workouts stimulate your sympathetic nervous system, speeding up your heart, raising blood pressure, and disrupting sleep. For older adults, this can quietly increase the risk of stroke during sleep. Crunches or sit-ups done too fast and without control. When the abdominal muscles are squeezed quickly and repeatedly, pressure in the chest and belly rises sharply. This can reduce blood flow to the brain, causing dizziness, blurry vision, or even fainting. Running fast on a treadmill without holding the side rails. It may look advanced, but older adults need to be cautious. Slower reflexes and reduced balance mean a small misstep can quickly turn into a serious fall. Falling while running may result in fractures, head injuries, or strain on blood vessels in the brain. Holding a plank for too long and forgetting to breathe. Planks are great for the whole body, but if held too long while holding your breath, chest pressure rises. Blood return to the heart and brain is reduced, and your heart has to work much harder. This can cause dizziness or head pressure. Standing up and sitting down too quickly and repeatedly. This is a common rehab exercise, but if done too fast, your body can't keep up with blood pressure regulation. It may lead to orthostatic hypotension, causing imbalance and an increased risk of falling. Exercise is the key to longevity. But as our bodies enter a more sensitive phase of life, we must move wisely, gently, and at the right pace, so that every workout becomes a renewal, not a gamble with your health. After age 60, many of us continue getting regular health checkups, and that's absolutely the right thing to do. However, some tests that seem perfectly routine can cause unexpected side effects, especially if you already have high blood pressure, fragile blood vessels, or reduced kidney function. Not every test is risky, but it's important to know which ones to consider carefully and when. Here are 5 common medical tests you should understand clearly before agreeing to take, especially if you're over 60. CT scan with contrast dye. You may have experienced this before. The doctor injects a liquid and says it helps make the image clearer. That's contrast dye often used in CT scans of the abdomen, chest, or blood vessels. The concern is that contrast dye can trigger immediate cardiovascular reactions, either a sudden drop in blood pressure or a rapid increase in vascular pressure. If you have heart disease, are taking blood pressure medication, or have weakened kidney function, these reactions can become serious. A study in the US found that adults over 65 had a significantly higher risk of vascular complications within 72 hours after receiving contrast dye during a CT scan, especially those with a history of high blood pressure or coronary artery disease. Stress test. This is a common test where you walk or lightly jog on a treadmill while your heart is monitored. It sounds like exercise, but in reality, the test is designed to push your heart into a stress state to assess how well it copes. If you already have high blood pressure or weakened arteries, a stress test can lead to excessive heart rate, arrhythmias, or even microvascular tears in the brain. A 2020 report from the American Cardiology Journal revealed that up to 7% of adults over 65 experience complications during the test, including dizziness, arrhythmia, and sudden spikes in blood pressure. Endoscopy with sedation. Stomach or colon endoscopies are often recommended regularly after age 50. But when intravenous sedation is used, your blood pressure may drop, and blood flow to the brain may decrease for a short time. The risk increases significantly if you're taking blood thinners like aspirin, warfarin, or Plavix. In that case, even a tiny clot that shifts could cause temporary brain ischemia. A 2021 analysis from the American Endoscopy Journal showed that adults over 65 were twice as likely to experience mild neurological symptoms within 72 hours after endoscopy, even if they were previously in good health. MRI with gadolinium contrast. MRI scans can be done with or without contrast dye. If your doctor recommends gadolinium to get a clearer view, ask questions first. Gadolinium is a heavy metal that is processed through the kidneys. In younger people, this happens quickly, but after 60, especially with reduced or undiagnosed kidney function, gadolinium can accumulate and remain in soft tissues or brain tissue. A 2019 study tracking over 2,000 older patients found that 5% of those who had an MRI with gadolinium experienced vague symptoms like dizziness, blurred vision, or mild confusion within days of the scan. It's not a full stroke, but it could be an early sign of impaired brain circulation. Carotid artery ultrasound just to be safe. Some clinics recommend carotid artery ultrasounds as a way to prevent stroke. It sounds reasonable, but if you have no symptoms, this test might lead to unnecessary surgery. Many people have only mild narrowing around 50 to 60%, yet still get told they need a stent or surgical removal. A study of 3,000 older adults in the US found that surgery did not significantly lower stroke risk in people without symptoms, while the procedure itself carried its own risks during and after intervention. In short, regular health checks are important. But at this age, the most important thing is understanding the hidden risks and making informed decisions that protect your body. Aging is something we can't control, but how we care for our bodies each day, that's completely in our hands. You don't need to give up your favorite nuts. You also don't need to stop exercising or going for regular health checkups. What truly matters is the timing, how you do it, and how well you understand your body. A handful of pecans in the morning can be a wonderful source of nutrition. But if you eat them right before bed, they might become a burden on your heart. A gentle yoga stretch in the afternoon can help calm your mind. But if it's an inversion pose done when your blood pressure is unstable, it could be risky without you even realizing it. Our bodies at age 60 or 70 aren't the same as they were at 30. That's not weakness, it's change that deserves respect. Blood vessels are more delicate. The nervous system is more sensitive. Digestion is slower. So take time to notice every little signal your body sends. A dizzy feeling after holding a plank, mild acid reflux after an oily nut snack at night, a restless sleep after a late evening jog around 8 p.m. All of these are gentle but important reminders that it's time to adjust. You deserve to live in good health not by pushing through like someone younger, but by understanding your body today and caring for it with kindness. If today's message speaks to you, or if you know someone over 60 holding on to habits that seem healthy, please share this with them.